As we all know, myelodysplastic syndromes are characterized by anemia in more than 90% of the patients, and many of them, in fact, about 60% of these patients become transfusion dependent over the time as the disease progresses. About more than a third already need transfusions at presentation. And obviously, this is a problem that we have to know how to manage. Previously, we have only blood transfusions as a treatment. Today, we have other treatments as well. So here I can say several things, and probably I would emphasize novel information that came out in this meeting. One piece of information that might be important is that we may be able to treat some of the patients earlier. For example, there is a paper by the European MDS group, which I am participating in. We showed that if you take patients with del(5q and you treat them with lenalidomide, for example, before they become transfusion dependent, you may delay the dependence on transfusion. There is another paper by the Spanish group. The lead author is Dr. Campello, showed similar data that if you treat patients with lenalidomide, then the transfusion needs are postponed. This, I should say, come also with another paper which was not presented this year but presented last year, and the paper is about to be accepted, hopefully. The European MDS group, led by Eva Hellström and Hege Garelius, we showed that patients who are treated with erythropoietin-stimulating agents, if they are treated with this ESA before transfusions, it may postpone the need for transfusion, and it is associated with prolonged overall survival. So this is one important piece of information. Another issue that have become relevant in discussing blood transfusions in MDS patients is the question, what is the threshold and when do you start transfusing the patients? Traditionally, we used to say that probably somewhere around hemoglobin 8, maybe even lower, it may be the threshold that you need to transfuse the patients. However, several studies, and Dr. Rena Buchstein alluded and emphasized this point in the symposium on Friday, the MDS Foundation symposium last Friday, that probably the quality of life is a very important issue, and quality of life is impaired even in higher levels of hemoglobin. This may be the trigger probably to reconsider and consider transfusing patients even with higher hemoglobin level. This is also consistent with my group presentation last year in ASH 2021. Also, we showed that probably in some patients, higher hemoglobin level may be the threshold for transfusions because of quality of life which is impaired and can be improved if you transfuse them. So I think the issue of blood transfusions will remain an important issue, but probably some points may be reconsidered after many years of stagnation.